Oh, good morning. Welcome to Health Talk with Dr. Mutiat. Thank you for joining me. I appreciate you all. Yay. Welcome for joining. Whoever is here, please say hi. Let's get started. Today is actually the whole month is Heart Month, like the heart month. So in celebration of that, we're going to discuss heart health today, what we can do to make our heart better. But before I get started, I'd like to normally do my spiel of please, this is not the end of be all. Anything I talk about here, please discuss it with your own primary care provider before you proceed. This is just for informational purposes, for educational purposes. So, if anything I say here resonates with you, please check with your doctor first before you start any program. So that being said, let us get started. Happy Health Month, Heart Health Month to everybody. Hi, Miss Tim Topwell. Thank you for joining. I appreciate you. Oh, I look great. Thank you so much. Thank you. So let's get started. Since you're here, we can get started. I won't keep you waiting. So heart health is very, very important because we know what the heart does for the body. It's one of the powerhouses of the body. With no heart, a lot of people will not be alive. So we need to discuss and celebrate our heart and learn how to take care of our heart. So very, very important conversation we need to have. All right. Now, did you know that 1 in 5 deaths, 1 in 5, for every 5 people, one of them, it's caused by heart issues, by the issues of the heart. 1 in 5 deaths, is caused by heart health issues. And you know what? One thing is I know the heart is a powerhouse, but it's very easily taken care of. If you take care of your heart will take care of you. So basically that's it. So we're going to learn in this video this week how to take care of our heart. It is simple. I know you've heard it 10,000 times, but I'm going to add one more time so you can hear 10,000 at one time because it is very important to take care of our heart. All right. So now, I being a healthcare professional in almost 20 years of practice, I'm not sure if I introduced myself for people that are joining me for the first time. My name is Dr. Mutiat. I am a nurse practitioner with 20 years in nursing experience, and I bring that wealth of experience to teach and discuss with people how we can better help ourselves. And my goal is to make sure we have healthcare information, creditable, reputable healthcare information to everybody free of charge. I don't charge for this. All I ask is that you share this video. If anything I say in here resonates with you, or you feel like other people need to hear it, please feel free to share this video and, hit the share button one time. That's all I ask. All right. So I've been a nurse for damn near 20 years and I have seen people, and one of the patients that have actually stuck with me was a young guy. I was telling my husband this story the other day, and he's one of the young guys that was having heart issues, and he came to the hospital. The doctors were going to do what we call a cardiac cath to fix some of the blockages in his heart. He is 40 years old, my age now, but this is damn near 10 years ago, so I was way younger than he was. And for some reason, we just clicked. We clicked so much, and we just, his wife would just laugh at us because how we get along was we just insult each other every single day. Like I walk in and I'm his nurse and I'm like, oh, you're still here. Oh, you're still my patient. And it's like, oh, I have you again as a nurse. It's just something we just do and we get it along with each other. And on the day he was supposed to go for a cardiac cath, we insulted each other on the way to cardiac cath. And I was like, I'll be here. I'll see you when you get back and we'll be fine. All of a sudden I get a cold blue. I hear a cold blue in cardiac cath. I just, I'm like, do I have a patient in cardiac cath? I'm like, cardiac cath can handle themselves. Those nurses are amazing. The doctors are amazing. So I don't have to worry about it until it was 2-3 hours later. My patient is not back. This is less than a 45 minutes or an hour procedure. And my patient is not back from cardiac cath. And I was like, what's going on? And, I just chilled. I was like, maybe they were having a delay. They had cold blue. They may have set them back. So I just chilled. And all of a sudden I see the wife in the room. I go check in the room, my other patient. And I see the wife packing his belongings. I was like, oh, where did he go? Think I was just teasing. And when she looks up at me, I saw her eyes were red, like someone that had been crying. And I was like, what happened? And it was like, yeah, the cold blue they called was my patient. And unfortunately, he did not make it. This is a young guy in his 40s. The age I'm in now, a very young guy in his 40s. That walked into the hospital that, he did have cardiac issues that we were trying to resolve. But unfortunately, he did not make it. So as blink of an eye, things can happen. So let us talk about how you can take care of your health that you not develop cardiac issues. And I'm also going to teach you some signs and symptoms that you need to be on the lookout for. And if you notice this, they are very subtle signs. If you notice this, please make sure you follow up with your doctors and have them take care of you. All right. So now we have understanding. I need you to understand heart disease. And when I say heart disease, there are a lot of diseases under it that we just classify as heart disease. One I talk about a lot, hypertension. Hypertension, often called the silent killer. That one has no symptoms. Hypertension, and it's hypertension. Let me correct any misconceptions anyone has right now that hypertension is only for older people. No, 20 years old, 18 years old, 30 years old, anybody can have hypertension. Even babies have hypertension. And if you develop hypertension, we need to take care of it. You can't be like, well, I'm just going to take the medicine. I don't want to be dependent forever. You are killing yourself. Once you're placed on a high blood pressure medication, you need to continue taking that blood pressure medication. If you stop abruptly, you will cause something called rebound hypertension, which is dangerous to you. So hypertension has no symptoms until it is like at the late stage. And what can it cause? It can cause a stroke, it can cause a heart attack. It can cause limb, you can lose a limb, you can go blind. Hypertension causes all these things. So please be careful. Another heart disease that we're going to talk about is coronary artery disease. This is when you have blocked arteries, like that patient I was talking about had coronary artery disease. You have blocked arteries from cholesterol, from fat, from things like that. So this can cause heart attacks and can cause a stroke, because if your artery, think of a pipe, think of a plumber, like, a pipe that you have in your house. If there's a blockage in one of your pipes, the one that funnels water to your kitchen, will you get water to your kitchen? No, because there's something blocking the water. So that's blocking your water. When you don't get water to your kitchen, now think of the kitchen as your brain. When you don't get water to your kitchen, which is your brain, you have a stroke. When you don't get water to your kitchen, which is your heart, you have what? A heart attack, a cardiac arrest. So there's a difference between cardiac arrest and heart attack. We will discuss that in another video, but there's a difference. But for this purpose we're going to say you're going to have a heart attack. Like there's no blood flow. If there's no blood flow to your brain, and if there's no blood flow to your heart, So are you understanding me, people? Are you understanding me? Thank you, Miss Candy. Please let me know if you have any questions as we're going. Please let me know if I'm moving too fast for you. As we're going, please let me know. All right. Another heart disease is heart failure. Heart failure. Heart failure is when your heart cannot pump very well. Like the muscle is just tired and it cannot pump. Now think of a foam. This is how I explain heart failure to my patients. And also I explain heart failure to new nurses. It's like, think of a foam. You have water running to your foam. To a foam, like a regular sponge. Now, if you pour water in, and the job of the foam, you squeeze the water out, it goes out and goes to where it needs to go. But now think of water pouring in, and the foam is not able to squeeze water to where it's supposed to go. So what's going to happen? It's just going to get soggy. And then the thing that's in there, the fluid that's in there, think of it as blood, it congeals and forms a clot. And when that clot happens and it goes to your brain, you have a stroke. It stays in your heart, you have a heart attack. So please, these things can develop. These are like just a summary, because this is a 30-minute video. So these are summaries of what I just, the biggest heart diseases. We have coronary artery disease, hypertension, and we also have heart failure. So please keep those in mind. These are diseases, the most common diseases that we experience. Now we have cardiomyopathy. We have other cardiomyopathies, but for the purpose of this short video, we're only going to talk about the most popular ones: coronary artery disease. We're going to talk about hypertension, and we're going to talk about coronary and heart failure. All right. Now, risk factors of developing these diseases. All right. They are almost the same thing. So I'm going to group them into one. All right. So we have modifiable, the things you have control over, and non-modifiable, the things you don't have control over. Again, modifiable risk, the one you have control over. Non-modifiable risk, the one you do not have control over. All right. Modifiable risk, the one you have control over, your diet. You need to eat lean protein. You need to eat more vegetables. All right. You need to eat less fat. All right. So also exercise. There are tons of cardiac exercises. You need to do cardiac exercises. My favorite two that I love to do is walking. If you follow me on my personal page, you will see I walk almost every day Friday, Saturday, Sunday, I'm outside walking because that's when I have enough time to walk. During the week, I do strength training. Monday, Tuesday, Wednesday, Thursday, Friday, I do strength training. But cardiac, you have to do walking. If you enjoy dancing, dancing is a great cardiac exercise. Dancing. Turn on the music. If you can't walk outside, like let's say it's not accessible to you because it's freezing or it's too damn hot. Turn on the music in your house and start dancing. You will get out of breath. When you're dancing, you get out of breath, you're sweating. Those are great cardiac exercises. Running if you like to run. Bicycling if you like to bicycle. So you need to exercise, all right? If you smoke, you need to quit. Because what smoking does, it narrows your arteries. Like you have a big pipe of arteries, and then when you smoke, it just narrows it. It narrows it and makes it thick. It's not supposed to be thick. Your vessels are supposed to be pliable. But when you smoke, you thicken it up. You don't want that to happen. When you thicken it up, it doesn't have expansion of capabilities, causing cardiac issues. All right? You drink alcohol. If you drink excessive alcohol, you need to quit. You need to quit. You smoke, you need to quit. You drink too much alcohol, you need to quit. Now, I'm not talking you drinking one glass of wine in social setting, whenever. I'm not talking about those. But if you drink constant alcohol every single day, you drink hot, you drink shina, all those gin, those tequilas, those rum, you drink it every day, you need to quit. You need to work on it and lower it and quit. Another thing that you can control is stress. Chronic stress is not good for your body. What it does, it raises cortisol, which causes hypertension. One of these days, I'm going to bring in a mental health person, but I need to get more people to watch this video. So when I bring them in, it doesn't look like we're talking to dead air. But I'm going to bring in a mental health person who's going to teach us all how to manage our stress. If you want that, you need to send me an inbox. Let me know you're interested in that, and I can set one up. All right. Another thing, like it's uncontrolled issues like diabetes. If you have chronic illnesses, you need to take care of them. If you have chronic illnesses, you need to take care of them. If you do not, you are going to cause cardiac issues. All right. So modifiable things you have control over. I'm going to run through them again. Your diet, you need to eat healthy. Your exercise, you need to exercise. If you smoke, quit. If you drink alcohol excessively, quit. If you're constantly stressed, please find ways to manage your stress. And if you have uncontrolled diseases, chronic illnesses, you need to monitor them. Now, those are the things you have control over. Now, non-modifiable risk, the things you have no control over. Number one, your age. You have no control over your age. As you grow older, unfortunately, sometimes you may develop chronic diseases based on the way you're living or you've lived. All right? Genetics, your genetics. You have no control over your genetics. I will say this though, to us Africans, to us Nigerians, I will tell you this, that you need to, I've said it several times, you need to know your family history. Not everything is Ojuaye. Not anything is VPN, Village People Network. Not everything is that. You need to look at the people in front of you that are related to you by blood. Your dad, your mom, your uncle, your auntie. And I'm talking your uncle and auntie that are related to you by blood. Your grandparents. Look at what happened to them. Look at the kind of diseases they're dealing with, because there's a good chance you will inherit one of those diseases. If your parents have high blood pressure, you need to work against high blood pressure. If your parents have diabetes, good chance you may develop diabetes. Any genetic issues are passed down by bloodline. So you need to see what's in front of you so you can prepare yourself against it or learn how to manage it. Okay. Now, your gender, men, women, you have no control over that. Okay. Yes. And also if you're trans, I will say this, if you're trans, remember your biological, if you go from male to female or female to male, you need to guard yourself against your biological pre-trans. I'm not sure how to explain that. So if you're trans and you know anybody let's use this example, that you are a woman that became a man. You need to make sure you see your gynecologist, because you were biologically woman. So you need to make sure you're following up with your gynecologist, you're doing your pap smear, you're doing everything. If you're male going to woman, you got to make sure you check your prostate, you got to check all that. So yes, if you are trans, these also applies to you. You need to guard against these things that you were biologically. All right. Question. I did a health check recently and I was told my LDL is a bit high. I was shocked because no one has anything of salt in them. Yes, LDL can be high. It could be you. It could be your diet, but it's very modifiable. Eat less fat, exercise, and eat more high LDL food, HDL food like fish, Titus, salmon, those things that omega-3, eat high of those and it can help bring down your LDL. All right. And also you've said some supplements, I think niacin, things like that, that can also help with that. So exercise, number one, exercise, do a cardiac exercise and watch your LDL go down. All right. All right. I love walking and it's currently freezing and dancing is my best bet. Yep. That's it. Just do it. Do it. Just do that. Let me see if I have any question. Birthday girl is here. Hey, Mike. Today's my baby's birthday. Happy birthday, Glory. Happy birthday. I know it's going to be a wonderful year for you. And, you know, I love you so much. And we'll talk on the flip side. Okay. All right. Let's go. Okay. So we've talked about that. Now let's talk about warning signs. Oh, let me just recap non-modifiable for you one more time. Non-modifiable, your age, your gender, genetics. Very, very important. All right. So there's diabetes in my family. So that's how it's Maureen. You're on the right track. If there's diabetes in your family, make sure you're doing your A1C and exercise. I know it's like I'm repeating the same thing over and over. Exercise and watch your diet and you will be amazing. You will do well and you're doing the right thing. Continue with that. Your A1C, continue check your A1C. Perfect. All right. Here are some warning signs. For most of these diseases, it's almost similar. So I'm just going to lump them into one for you. Okay. All right. The classic heart issue signs, chest pain. Everybody, they'll feel chest pain. All right. Shortness of breath, dizziness, and fatigue, tiredness. Those are the classic signs. Now, the non-classic signs, the silent signs that you should be on the lookout for, especially if you're a woman. If you are a woman, all right, jaw pain. Yeah, I know. Some jaw pain are signs of your heart not doing well. Acid reflux. You feel like your stomach is burning. Like it comes up like an acid reflux. Some women, nausea. Yeah, I know. Yoruba is ayarinyo. It's ayabarinyi. Yoruba, that's it. I'm going to learn what it is in Igbo and outside and I'll let you know. But ayabarinyo. Like, nausea. All right. So, and swelling in the legs. If your legs swell for no reason, you need to go see your doctor. If you notice leg swelling, go see your doctor. All right. And if you're just all of a sudden tired for no reason, you're just tired, exhausted, and it's not been relieved by rest, go and see your doctor. Everything is not just, maybe I should just rest, I'll feel better. No. Jaw pain. Yes. I've seen women come in for jaw pain. Like, something's wrong. I just feel like it just hurts a little bit. Until I was having a heart attack. Oh, yeah. Yes, I've seen it with my two kurukuru parts. I have. Nausea, uncontrollable nausea. I've seen that one too. Yeah, I have. My days in cardiac, I used to see that a lot. All right. So swelling of the legs, please make sure you see your doctor. Even if it's not heart issues, it could be a kidney issue, but your legs should not be swollen for no reason. Your legs should not stay swollen. You should not have fluids in your leg. Absolutely not. You need to go see a doctor. All right. Now, what we can do, healthy habits we can do to make sure we are keeping our heart healthy. Let's talk about nutrition. I know I kind of glazed over it earlier. Eat lean protein. You eat chicken. We eat fish. You can eat meat too, but in moderation. Plant sources, eat all those things, okay? High fiber food, fruits, vegetable, whole grains, brown rice. What else is brown? Anything, pretty much almost anything brown that's whole grain. You can eat those, all right? Healthy fats, avocados, olive oil, omega-3. Omega-3 is in fish. You can also take an omega-3 supplement, coenzyme Q. All those can help you also. What should we limit? Excessive sodium, excessive salt, excessive processed foods. Any food that you don't cook yourself. Nowadays, I'm learning how to cook food myself. I was a queen of, let me just pick up something. Even like all those restaurants. No, I cook it myself. Like as I'm talking to you right now, I'm marinating meat that I want to use to make suya. Yes, I'm cooking it myself. Normally, I'll just go and buy it from the store, but I'm cooking it myself. All right. Excessive sugars and refined carbs, all those white bread, white pastas, white everything. Now, I'm not saying don't eat them. I'm just saying eat them in moderation. All right. Eat them small. If you can, transition to whole grain foods. That's better for you. All right. Any food that's high in fat, aura, that makes food, that we like our aura. Again, please cut them out as much as you can. Cut them out. Some people go to the extent of taking cut off chicken skin. Me, I like chicken skin. No, me, I won't lie. I eat chicken skin. I eat chicken skin. I eat skin. I like my mama, but in moderation. In moderation. And drink water. If you're drinking soda, stop it. Drink water. Water is good for you. Water, agua. Apart from that, see how my skin is popping. Someone actually told me they thought I was using filters. This is not filtered. This is how I look. If the person actually came to my house and be like, this is how you really look. Yes. There's no filter here. My skin stay popping. My skin stay glowing because agua, bull, meri, umi. What's water in Hausa? Someone tell me so I can add it next time. All right. So please try and cook your meals yourself. Limit the amount of salt you're taking. Notice, I didn't say stop eating salt. Notice, I did not say stop eating salt. I said limit, moderate. I would never, no healthcare professional will ever tell you to stop eating salt because salt has what it does to the body also. Salt has its own goodness for the body. I think I talked about this a while back, but I can bring back the topic again. But I didn't say stop eating salt. I said limit, moderate how much salt you eat. Keyword, limit, moderate, not stop. No one will ask you to ever stop eating salt. We don't do that. All right. So we're talking about food. Let's talk about exercises. I know I also glazed over it earlier. Personally, I like walking. I'm a big girl. I can outrun. Please, I like my joints. Some people like running. If you like running, for you, good for your heart. Enjoy running. Some people like bicycle riding. Good for them. That is good. Dairy should not. No, you can eat low-fat dairy. You can eat dairy in moderation. All right. You can. I'm very conscious of my heart health. Very good. Is that Lobito? Lobito, like my senior in high school, Lobito. Oh, how are you? Long time. How are you? How are you doing? Oh, it's a pleasure. That's Lobito. Oh my God, it takes me back to like high school in Nigeria. Oh, that's senior Lobito. All right. Okay. So we're talking about what you can do exercise-wise. You can dance. You can climb stairs. Just climb stairs up and down. That, trust me, it will work your heart. You start doing Pilates. Good. Pilates, though, it's not really a cardio exercise per se. It's more of a muscle exercise. You need to also add in cardio that, like, just climb your stairs every day. That's it. Don't take elevator. Up and down your stairs. Count that. And also walk. Like I do, walk. I have my pedometer, it's only 11:25 and I have 7,000 steps already because I went on a 1-hour walk before this. And when I'm done, I have to do my chores and I'm definitely going to hit my 10,000 steps. Now, also, if you wear a pedometer, between 6,000 and 10,000 steps is the goal. Now, 10,000 is not the end all be all. That's a gimmick from like a Japanese company when they wanted to sell pedometers. Between 6,000 to 10,000 steps daily is your goal. Let's say you normally don't walk in the first instance. Like your regular daily walk is like 3,000. Make your goal 5,000. Don't go from 3,000 to 10,000. You will not sustain it. The goal is sustainable change. Sustainable change. All right. I lift weight while climbing my stairs. There we go. You have added it. That's it. So sustainable change. If your normal walking distance or what you normally walk in is 3,000, try and get yourself to 5,000 daily. Once you hit that 5,000, make it 6,000 daily. So the more you walk, the more stronger your heart is. And also you will lose weight in the process because the more you do more activities, your body will burn the fat. So do it slowly. Add 1,000 steps each week, if possible, or each 2 weeks, whatever works for you, whatever will make you sustainable for you. So my personal goal is 6,000 steps daily on a regular day. And on the weekends, it's 10,000 steps. I try to get the 10,000. Most times I don't hit 10,000, but at least I hit my 6,000. All right. Okay. So like I said, dancing also, you can dance. You can dance. Just throw on music and boogie, and boogie. Just dance. All right? All right. So now let's talk about the thing a lot of us don't do that we need to do. I'm running over time. One of the things we don't do is we need to sleep. You need to sleep. Or people are like, they're so proud of, oh, I only sleep 4 hours a day. And you are killing yourself. Auntie, uncle, you're killing yourself. You need to sleep. You need to sleep minimum of 7 hours a day and maximum of what you can. If you can afford 8 hours a day, 10 hours a day, whatever you can get in. But minimum 7 to 8 hours a day of sleep. Because if you do not sleep, remember I told you guys that during your sleep is when your body regenerates itself, resets itself, recalibrates itself. If you're not sleeping, your body is not able to recalibrate and regenerate and fix itself. All right. And if you're not sleeping, what you're doing is increasing your cortisol level. And high cortisol level is stressing your body, which in turn can lead to hypertension. You're like, well, but I don't do anything. I don't think. I don't stress. Yeah, you are stressing because you're not sleeping. Stressing does not mean you're thinking about, oh, the world is coming to an end. No. Stressing is you're not sleeping. You're not resting your body. You need to rest your body. You need to rest your body. All right. You need to sleep. Trust me, sleep one day. Dedicate one day, just one day, to sleep 8 hours and wake up in the morning and tell me you don't feel rested and energized to do anything. If you don't, try it one time. And if you don't feel rested and energized, come and tell me. Call me a liar. The one day you sleep 8 hours a day, you wake up like this, the whole world is your oyster because you can't do anything because you're very energized. You can do a lot of things. All right. So you need to sleep. Make it more of, I sleep 8 hours a day, minimum. But I'm in bed by 9 p.m. and I wake up at 5 a.m. almost every day. So please make sure you are sleeping. All right. Now, another thing we all need to do is we need to check our blood pressures. I actually thought I brought my blood pressure machine in here. I did not. I did not bring my blood pressure machine in here. So please check your blood pressures. Make sure you're seeing your primary care providers at least once a year. Or you can go to the nearest pharmacy beside you and let them check your blood pressure. Or you can have your own machine. I prefer that you do the one of your arm, not of your wrist. Since I started sleeping well, I felt different. My brain is, my brain has been 100% and my mood is better and I feel more happy. The end. That's all. That is all. That, Miss Adesua, God bless you. You just exactly sleep. Trust me, if you sleep very well, your body, your mind, your mood, everything is going to be different. Sleep, wake up, exercise. I promise you, do that for like 30 days straight. Maybe I should even start the challenge. We have just started February now. Maybe on Monday I should start a challenge of walking daily. We can hold it here. All sleep or work. I'll find a way to create a challenge and we can all do it together. And you come tell me how you feel. Tell me how you feel. I promise you, you're going to feel better after 30 days. All right. So like I said, now we need to go and check your blood pressure. You need to know what your blood pressure is. In the comments, can anyone tell me what the blood pressure is? What is the blood pressure number? Tell me in the comment what blood pressure number should be. What is the acceptable blood pressure number? Let's go. I'm watching because I've been doing a lot of talking. I want to interact with you guys. All right. Doesn't matter be day or night. No, if you're a night shift worker, as long as you're sleeping during the day, but consistently. Because I used to work night shift and I slept during the day. I slept from 9 a.m. to 5 p.m. daily when I worked night shift. I worked night shift for damn near 18, 19 years. I just switched to day shift now. But if you're a night worker, sleep during the day consistently. Sleep it. And if you're a day worker, the same thing. Sleep at night. Just try and get it in at one time. I know some people like to break it, but you're not giving yourself enough rest. You need to actually try work your way to sleep in it one time. All right. 120, 125, 85, 120, 80, 120, 70. I'm still looking for comments on what the blood pressure should be. Okay. Also, what should be the normal heart rate? What is the range of normal heart rate for people? Do we know? Let's see. I'm waiting for the comments. What should be your normal heart rate? What is the range? I'm all here. I'm hearing. I'm listening. Meanwhile, I'll just quickly look at comments and make sure I didn't miss any questions. Okay. 121 over 80. Okay. Her blood pressure. Yes. The normal acceptable blood pressure is 120 over 80. Everybody is almost right. I like that you know this. 120 over 80. Now, not to say if your blood pressure runs low, like there's some people that live at 110 over 70, 110 over 80. That is your blood pressure. You just need to know where you are. I know where my blood pressure ranges. I know where it is. If it rises, then something is off. Then I'm like, what's wrong? There's some people that are never at 120 over 80. They're lower. And the normal heart rate should be between 60 and 100. Below 60 is bradycardia. Above 100 is called tachycardia. You don't want to be above 100. You don't want to be below 60. So you need to be between 60 and 100. That is normal heart rate. Okay? So now let's do true or false. Let's play a game. All right? You need to have chest pain to be having a heart attack. You need to have chest pain for it to be considered heart attack. True or false? I'm listening. True or false? You need to have chest pain to have heart attack. Yes, I'm listening. I'm listening. I'm listening. I'm listening. I'm listening. All right. Do you false? All right, Mr. Mtoko, you're right. False. You don't have to have chest pain to have heart attack. Some people have nausea. Some people have jaw pain. So you don't have to have nausea. You don't have to have chest pain to have heart attack. Thank you, Ms. Maureen. Okay, well done. You don't have to have that. All right. Only older people, only elderly people have heart diseases. Yes or no? Is that true or is that false? Only elderly people develop heart disease. Is that true? Is that false? Is that true? Is that false? I'm listening. Okay. I'm listening. I'm here. I'm here. I'm listening. The answer is false. Not only elderly people, anybody can have heart disease. Anybody at any age can develop heart disease. All right. Only now the last question. All right. Only vegan or plant-based foods are the only way to prevent heart disease. Eating only plant-based food or vegan foods are the only way to prevent heart disease. Is that true or is that false? Swimming is also great. Yes, you're right. Mr. Steven, thank you for that. Swimming is also great. It's a great exercise. I apologize. I forgot that. If you enjoy swimming, you don't need a pool. If you have a river beside your house, jump inside the river and do your laps inside the river. Just make sure you can swim. Okay. If you're in Nigeria, make sure you can swim because there's no lifeguard. All right. Good. Miss Maureen, you're right. Okay. That's true. Mr. Midokwe, you're also correct. You need a balanced diet of lean proteins, vegetables, healthy fats to, make sure you don't develop heart disease. Okay. All right. So we are way over. It's 35 minutes. We are way over. So, but I'm going to leave you with this. All right. Heart disease is preventable, very preventable. All right. With small, consistent changes. What changes do you make? Eat lean protein, exercise, don't drink, don't smoke, minimize stress. Just continue to do those and sleep. All right. Sleep. Okay. Eat well. Like I said, that's how you prevent it. Eat well, manage stress, and get your health care and get your health check. Your heart is working 24/7 non-stop. Your heart does not have a break. What can you do to help it? Just do everything right to support. Because it doesn't, when the day your heart stops, you have left earth. Oh, you are not without, all happy, you have died, you have left us. Oh, no, I'm learning Igbo, small, I know, all happy, no, I know, something like that. Like you have left us, okay? So, Q, is peanut oil healthy? I think, but there's some people that have they're waging current wars against seed oils. Personally, I eat peanut oil if I have it, but I was raised on vegetable oil, so that's what I eat. Vegetable oil. Sometimes I eat coconut oil. Sometimes I eat avocado oil, olive oil, whatever oil I can put my hands on that is on sale. But remember, it is all in moderation. Don't eat too much of oils. It's more in moderation. So your heart is always working 24/7. So you got to support it. You got to make sure your heart is doing well. Exercise, eat well, don't smoke, don't drink. Give your heart something fun to do, okay? Because it can't stop. It cannot stop. Once it stops, bye-bye, All right. So before we go, now I want you to tell me on this comment, what is one thing you are going to do for your heart today? Or you're going to start doing for your heart? I'm listening. What is one thing that you're going to start doing for your heart? And while you're doing that, I am going to tell you, thank you so much for joining me today. Thank you for watching me. Thank you for sharing this video. If anything I've said in this video resonates with you, please hit the share button, like, send to your friend, invite your friends. Come here. We are here every Sunday. I'm here every Sunday at 11 a.m. Texas time and 6 p.m. Nigerian time. Figure the time around from there. All right. So please, please, please like this video, engage with this video. This encourages me. I don't ask you for money. I don't ask you for anything. I just ask you for encouragement to let me know you guys want this. You guys need this. You guys enjoy this. And if there are any topics you want me to talk about, please feel free to enter my inbox and send me. All I ask is you get to the point. Like, hey, Mutiat, I'd love you to discuss this topic. No problem. I will. Hey, Mutiat, I'll help you. I want you to discuss I will. If it's not something my specialty, I will get specialists. I've reached out to people that are specialists and they're willing to come on. But I'm like, I only have 10 people watching my video. So I don't know if it's good of their time. So I wanted to wait a little bit to, but if it's share, engage, encourage me that this is, you guys are enjoying this. That's all I ask. Share this video, like this video, invite your friends. Let's be more than 17 on this video. All right. Walking more. Exactly. To exercise and eat healthy. Miss Larry, when you say to exercise and eat healthy, man, what do you mean? And also, I wanted to thank some people that were in this video last week. My mom and my dad's friends. I've always respected those people. Like, my dad died quite early, younger, and his friends have always been in my life. They've always been. Last week, I saw some names that I wasn't sure of, and I was reading up on them, and I looked at where they're from, and I saw lafrograms. And anything when I say lafrograms, I know they're my mom and my dad's friends. And thank you, Ma. Thank you, Saz, for supporting me. I appreciate you so much. Thank you so much for all the support. I appreciate you. Thank you so much for looking out for us. I'm sure my dad is looking down from heaven. And thank you guys for being there, supporting his kids when he's not here. I really thank you. The whole group of Lafogram, I think you guys are 77. I may be wrong. But the Lafogram crew, I really thank you so much. All right. They said sex is also good exercise. It is, but it's not. How long are you having sex for? You need at least 30 minutes, ongoing. So that's what I would say about that. Lafograms is your alma mater. For real? Really? Oh, I didn't know that. Wow. All right. Miss Glory says she's going to eat more healthy. Perfect. Miss Timitokwe, eat more vegetable, fish, and exercise more. Okay. All right. I like that you guys all have plans, and please keep along with it. Please, if you thank you for joining the video one more time. I appreciate you so much. Thank you so much for joining. And it's been real. Dr. Sunshine, Dr. Mutiat, Dr. OG, because the OG crew is always screaming, why am I not mentioning OG? Yes, I'm Dr. OG, Dr. Sunshine, Dr. Mutiat, whatever you call me. I am signing off. And please take time to take care of your heart. You only have one heart. Only have one heart. And once it stops, Hapugi is gone. Don't make fun of my Igbo, but I'm learning. Okay. It's been a pleasure being here. Thank you one more time. Don't forget to share, like this video, engage with it, share with your friends, and invite your friends. So we'll figure out what next week's topic is going to be. It's been a pleasure. Dr. Mutiat signing out. Live healthy.